Good evening to all dignitaries, program officers, students, and everyone present here. Today, we have gathered here for yoga training session for enhancing immunity on the occasion of International Yoga Day, which is celebrated every 20th of June. This year theme is unity and well-being. We all experience stress, anxiety due to our unhealthy lifestyles and busy schedules. But practicing simple yoga will improve our overall health. And as students, it will help us to be ultra focused while we are studying. Today, millions have suffered from coronavirus that damages our lungs. But practicing a simple yoga as pranayam will help us to improve the function of our lungs. COVID pandemic has almost forced us to be completely reevaluate our lifestyle choices and decisions and made us to look at health as a crucial part of our life. So the NSS cell of NTR UHS has taken the initiative to conduct yoga training session for enhancing our immunity. Myself, Anisha Valli, NSS volunteer of Dr. NTR UHS, studying 4th year BDS, GSL Dental College, Rajahmundry, and my co-NSS fellow volunteer, Sai Anusha from AC Subba Reddy Medical College, Nellore, welcomes you to this program. Now I'm privileged to welcome Yoga Acharya, Dr. Vivekanand, NSS Program Coordinator of Dr. NTR UHS, Andhra Pradesh. We welcome you, sir.
Thank you.
Now, I'm pleased to invite our Honorable Registrar of Honorable Vice Chancellor and NSS Chairman, Dr. Shyama Prasad Garu. We welcome you, sir.
Thank you.
Now I'm glad to invite Honorable Registrar of Dr. NTR UHS, Dr. Shankar Garu. Pleasant welcome to you, sir. Now I take the privilege to welcome Dr. P. Srinivas Rao Garu, Master Trainer of today's session. We welcome you, sir. Now I take the privilege to welcome Ms. Monica and Ms. Bhumika, yoga demonstrators, for this training session. If any of your friends are unable to join today's session, please ask them to join the Facebook Live of Dr. NTR UHS NSS page for live streaming and train themselves and ask questions, which is moderated by organizing committee. Now I take the privilege to welcome Dr. Yoga Acharya Vivekanand Kattimani Garu, NSS Program Coordinator of Dr. NTR UHS Andhra Pradesh, to deliver a welcome address.
Thank you very much, Anisha. So, good evening to all once again. I am Dr. Vivekanand Kattimani, NSS Program Coordinator of the NSSL Dr. NTR Health University, Andhra Pradesh, Vijayawada. Very happy to welcome you all to this August gathering. Today we have gathered here on the occasion of International Yoga Day celebrations. It's a time to learn and teach healthy practices among our family members, neighbors, and friends to make sure that everyone will stay healthy and happy in this COVID pandemic. I'm very happy to announce we have received more than 1,500 registrations and we have stopped the registrations. Now we are no more taking registration. Still the requests are coming for the registrations. So we are diverting them to Facebook Live. Before we start training, I just want to enlighten all of you people about 8 limbs of yoga. I am one of the yoga practitioners since 35 years. And it is my utmost honor to tell you about the Ashtanga. Ashtanga is 8 limbs. So glimpse of Yama, Niyama, Asana, Pranayama, Dharana, Dhyana, and Samadhi. As a part of our culture, we do practice Yama, Niyama, Pratyahara, Dharana, and Dhyana without our knowledge. by our mother and by our elders who are going to teach us during our childhood. All these things will be inculcated during growth period. Whereas coming to asana and pranayama, we need guru, because the guru is going to teach about the asana and pranayama, where you are going to train your body and mind. That's very important part. So today we have a master trainer who will teach us in a very similar way about asana and pranayama. So in 5 days, we will learn how to keep ourselves fit, healthy, and happy. Also to learn how to make others healthy and happy, because we are all health professionals. Until unless we are healthy, it is not possible to make somebody else healthy and happy. If you are suffering, definitely you cannot treat others. So with this, a small welcome address, I once again welcome you all, and I request Anisha to continue with the program. Thank you very much. Over to Anisha.
Thank you, sir. I deem it our proud privilege to invite our Honorable Vice Chancellor and NSS Chairman, Dr. Shyama Prasad Garu, to inaugurate the program with the inaugural address.
Thank you, Anisha. Can you hear me?
You are audible, sir.
Yeah. Dr. Shankar Garu, our registrar, our coordinator, Kattimani, and several people who have joined, more than 1,500 people, a very big crowd, and has gathered by this gentleman, so-called Vivekanand. And I'm very, very happy to delighted to inaugurate this online teaching program on yoga. And the day today, I know that Vivek was trained yoga master. This I don't know, he didn't tell me. And then I never asked me also. A 30-year-old experience in yoga is something great, extraordinary for a medical man. A dental surgeon like facial surgeon practices yoga, has inculcated this habit of yoga in his lifetime. Why not us? We will also make it, compete with him and do the best possible work. Recently, we have done NSS has conducted a stress management and a yoga program. Everybody has enjoyed it 2 days back. And COVID gave us so many lessons. One among them is doing exercises within our room. What are the best things? We say Surya Namaskarams, moving the limbs, sitting, standing, like that. Apart from yoga is all ancient. And Yoga Day was celebrated in every country now. Not only India, it becomes an international thing. And we are going to learn yoga for next 4 or 5 days. Yoga is seen, learned, and practiced all over the world. So we should be part and parcel of this good habit, inculcate in our life, and do best, healthier procedures. I think we request all the people, both students, teachers, and elderly people also who joined us, should learn the art of yoga and practice every day. So all the best for the participant to successfully practice yoga in everyday's life. Thank you very much. Over to Anisha. Thank you.
Thank you, sir. Now the most awaited moment. A man of a fantabulous passion and tremendous hard work in his profession. We are immensely blessed to have in our midst Dr. P. Garu as our master trainer training session. Sir completed his MBBS from Langanai Medical College, Kattimani in 1985. He his MD in physiology, and Sir had served about 25 years as a successful private medical practitioner in Vijayawada. So presently working in Dr. Vivekanand Siddhartha Institute of Medical Sciences, Gannavaram, and is an active practitioner for 20 years and is also a marathon runner. So many languages: Telugu, Kannada, Tulu, Hindi, English, with Kannada being his mother tongue. To his first credit, he did many academic presentation and being a resource person for many international national conferences and conventions. Sir is also a BLS and a first aid trainer. He's also a social worker and organized many health-related camps and programs like menstrual hygiene, breast cancer, and cervical cancer awareness. Sir published many national and national papers. To say, sir, also worked as an NSS program officer and secretary to IMA Vijayawada, founder and present president of Bharati PO. And he did a lot of COVID relief activities with this banner and doing now also. With this brief introduction, I'm pleased to invite Dr. P. Srinivas Rao Garu to continue this training session.
Thank you, Anisha. I hope Registrar Sir has to give the remarks before the session starts for the closing of inaugural program. Sir, Registrar Sir, Shankar Garu, you are welcome, sir. Sir, you are unmuted, sir. You can speak, sir.
Okay, good evening all. Good evening, Honorable Vice Chancellor Dr. Shyam Prasad Garu, and good evening, Vivekananda Garu, and our today coordinators Anisha and Anusha, and Srinivas Rao, today resource person. So this is a 5-day online yoga session. I think many people are eagerly waiting for the training. So I think the Srinivas Rao Garu, being physiologist, and this is because many people can train the students and youth, but here the different issue is the today resource person is the physiologist. So being physiologist, I think he can impart better yoga classes than others, I believe, because he is well aware of sympathetic nervous system, parasympathetic nervous system, and autonomic nervous system, and everything, because these are all the systems which control all the systems in the body. All organs and systems in the body will control under the nervous system. So he's experts in the being physiologist, experts in the physiology of the neurotransmission. So he can explain better and coordinate yoga classes to the physiological process. So I hope that you will get better knowledge than any other trainer. He's a master trainer, and mere training is not sufficient. After getting this training, you have to get regularly, you have to practice this yoga. So with this, I think, I hope that you will get a better health, both physical health and mental health due to regular practice of yoga. Okay, this is well and good. So after obtaining your mental and physical health, is a very good thing for a citizen of India. But that is simple getting mental and physical health is not sufficient to develop India. So a citizen of India, after getting health, and we have to think about the many pitfalls in the country. I hope that we have to focus many ill events in the country, and mainly the youth, NSS youth, have to fight against a few elements which are rampantly present in India. So first, the NSS youth, after getting your physical health and mental health with the yoga, you have to concentrate on, you have to fight against the few features that is the India. First feature is the corruption. You have to fight, NSS youth have to fight against corruption. This is the first you have to remember, all NSS youth. And second thing is the pollution, different types of the pollution in the country. We have to fight against, because without removing the pollution, without controlling the pollution, even if you are healthy with the help of the yoga, so your health is not in your control, because all surroundings polluted with the air. you cannot achieve the good events obtained from the yoga. That's why the NSS youth they have to fight against different policies existing in the country and corruption existing country, and also superstitions. A lot of superstitions people are having. So this is also another event we have to fight against the superstitions, and we have to fight against the most important is the casteism. Casteism we have to fight, and we have to fight against creed also. That is the what you can religion. We have to fight against religion. We have to fight against casteism, and we have to regionalism also. We have to fight. So I advise all NSS volunteers once again, after getting your health with the help of the yoga, you remember without just mere obtaining the physical health and mental health, you cannot develop our country unless the NSS youth fight against what I told, all these ill events in the India. Once again, I am repeating, that is the corruption, different types of the pollution and superstitions and casteism and regionalism and what you can say, reasonism. All things we have to fight against. Once again, I wish today resource person, Srinivas Garu, I wish you all the best to carry this program.
Thank you, sir. Now I'm pleased to invite Dr. Srinivas Garu to continue the training session.
So before sir starts, let me give some instruction to all the participants. We do have a lot many participants in the session. My request for the participants will be, usually yoga will be practiced in the morning on empty stomach. But because of a lot of constraints and our practices, life schedule, so we wanted to make sure that everybody can practice at the chair. So that's how the training is going to be given by Srinivas Rao. It has been very well taught and very well having the scientific background, because in day-to-day life, usually we sit, already they are getting ready with a session. Okay. So we'll sit a lot of the time in the chair and we don't have much of physical exercise. So all those things will make a difference. That's why what we thought, let us give very basic exercise like asana for everyone who can perform that during the sitting posture, either in the office or either at the home. So that's how we can start the session, and that's how you can learn yourself in a very easy going way. Actually, these are modified exercises which you are going to adopt even in your life in the beginning. Then later you can perform the same thing in a better fashion in the early morning, soon after your prathar vidilu. So morning you wake up and you have a toothbrush, cleaning done, then you empty your stomach, then you can sit and you can do the exercises. Now you can see on the extreme corner. So you are going to see the two demonstrators we are having. So sir is going to start the narration, then you will be having the people who will be performing. Along with them, you can also start performing. The way of explaining is, first sir will explain you what they are going to do and how they are going to do, and you can watch them three-dimensionally because there are two demonstrators who will be demonstrating. So you can watch on your screen. So active screen will be seen on your screen, so you can modify yourself the bigger screen one.
Good evening,
so
all of you.
Sir, hello,
Am
sir.
I audible?
Yes, sir, you are audible, sir. Definitely you are audible. You are audible, but your screen is not visible. So your mobile screen, I think the video is off.
Hello, am I audible?
Yes, sir, you are audible, sir. You are audible.
Okay, thank you, thank you.
Yeah, go ahead, sir.
So thank you very much for giving me this opportunity of conducting this workshop. NTR Health University is going to be remembered in history also, because this is the first time that a health university has really taken up such a very big task of teaching people all over the country by using the online media. So very happy that I am a part of this great endeavor. Thank you very much. We are joined by Miss Maunika, who is a yoga teacher, and also by Miss Bhumika, who is from Dr. Pinne Siddhartha Medical College, who joined our college in 2019 and is an avid practitioner of yoga. So they will be demonstrating today. Yoga is an invaluable gift of ancient Indian tradition. It embodies unity of mind and body, thought and action, restraint and fulfillment. By changing our lifestyle and creating consciousness, it can help us to deal with COVID-19. Let us work together towards adopting yoga as a way of improving our own, our families, our states, our nations, and the health of entire humankind from this International Yoga Day. Jai Hind. Before we actually go into the practice, I would like to remind you of certain things which you have to do when you practice yoga. Before the practice, Saucha. Saucha means cleanliness, an important prerequisite for yoga practice. It includes not only the cleanliness of the surroundings, but also of the body and mind. Yogic practice should be done on an empty stomach or light stomach. Consume small amounts of honey in lukewarm water if you feel weak. Bladder and bowels should be empty before starting yogic practices. A yoga mat or a folded blanket should be used for the practice. Light and comfortable cotton clothes are preferred to facilitate easy movements of the body. Yoga should not be performed in a state of exhaustion, illness, and you should not be in a hurry or in acute stress conditions. It should not be done. In case of chronic disease or pain or cardiac problems, a physician or a yoga therapist should be consulted prior to performing yoga practices. Yoga experts should be consulted before doing yoga practices during pregnancy and during menstruation. Now, what are the precautions we have to take during the practice? Practice sessions should start with a prayer, as it creates a conducive environment to relax the mind. Yogic practices shall be performed slowly in a relaxed manner with awareness of the body and breath. Do not hold the breath unless it is specially mentioned to do so during the practice. Breathing should be always through the nostrils unless instructed otherwise. Do not hold the body tightly or jerk the body at any point of time. It should be done in a very relaxed way. Perform the practices according to your own capacity. Just because the people who are demonstrating can do it very well, don't try to reach that stage of perfection. It will slowly come one day. Practice is more important. It takes some time to get good results. So persistent and regular practice is very essential. There are contraindications, limitations for each yoga practice, and such contraindications should always be kept in mind. Yoga session should end with a meditative or a deep silence. After the practice, bath must be taken only after 20 minutes of practice. Don't do it immediately. Food may be consumed only after half an hour of practice. So let us see how yoga can help us before we actually practice it. Medical research in recent years has covered many physical and mental benefits that yoga offers. corroborating the experiences of millions of practitioners. A small sampling of research shows that yoga is beneficial for physical fitness, musculoskeletal functioning, and cardiovascular health, as our respected registrar told us. It balances the parasympathetic and sympathetic systems, which is very necessary in these times of stress. It is also beneficial in the management of diabetes, respiratory disorders, that is COVID also, hypertension, and many lifestyle related disorders which are causing havoc in society today. Yoga helps to reduce depression, fatigue, anxiety disorders, and stress. Yoga regulates menopausal symptoms. In essence, yoga is a process of creating a body and mind that are stepping stones, not hurdles, to an exuberant and fulfilling life. Now we shall start with a simple prayer. योगेन चित्तस्य पदेन वाचा बलं शरीरस्य च वैद्यकेन योपाकरोतं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिर्नतोऽस्मि. And now we will start with loosening practices. The yogic Sukshma Vyayams helps to increase microcirculation. These practices can be done while standing or sitting. Samasthiti, alert posture. Stand with the feet comfortably apart. Keep the hands straight beside the body. This is Samasthiti. Keep your hands on the waist. I request all of you to also follow not only my words, but you should also be doing what I'm telling. I'll be telling it very slowly so that all of you can also join in this training session. Because by hearing, nothing can be useful. If you do it, you'll be getting doubts which can clear in the last 5 minutes, where I'll be clearing any doubts that you have. First, we'll have neck bending. While exhaling, move the head forward slowly and try to touch the chin to the chest. While inhaling, move the head as far back as is comfortable. This is 1 round. Repeat 2 rounds. Exhale, move the head forward slowly and try to touch the chin to the chest. And slowly inhale. Next is right and left bending. While exhaling, bend the head slowly to the right. Bring the ear as close as possible to the shoulder. without raising the shoulder. While inhaling, bring the head to normal position. Similarly, while exhaling, bend the head to the left side. Inhale and bring the head up to normal position. This is one round. Repeat 2 more times. Slowly. Now, right and left twisting. Keep the head upright. While exhaling, gently turn the head to the right so that the chin is in line with the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, turn the head to the left. Inhale and bring the head to the normal position. This is one round. Repeat 2 rounds. Slowly inhale and exhale. Next, we will have neck rotation, but these postures, anyone who is having cervical spondylosis, please don't attempt it now. Just watch it today. You can attempt it afterwards. Neck rotation. Exhale, bend the head forward, trying to touch the chin to the chest. Inhale, slowly rotate the head clockwise in a circular motion. Exhale while coming down. Do a full rotation. Then rotate the head in anti-clockwise direction. Inhale. Go back and exhale and come down. This is one round. Repeat 2 rounds. Move the head as far as possible. Do not overstrain. Keep the shoulders relaxed and steady. Feel the stretch around the neck and loosening up of the joints and muscles of the neck. It can also be practiced by sitting in a chair. People with neck pain can do the practice gently, especially when taking the head back to the extent it is comfortable. Elderly people and persons with cervical spondylitis, high blood pressure should do this after consulting their doctor. Because cervical spondylosis is a very important disease, which is because of the bad lifestyle that we are having and using the cell phone, computer in the wrong posture. So these exercises help us to strengthen the muscles around the neck. We come to the next loosening exercises, Samasthiti. Keep the legs about 2 to 3 feet apart. Raise both the arms up to the chest level with palms facing each other and keep them parallel. While exhaling, twist the body towards the left side so that the right palm touches the left shoulder. Come back with inhalation. While exhaling, twist the body towards the right side so that the left palm touches the right shoulder. Come back slowly with inhalation. This is 1 round. Repeat 2 more times. Slowly inhaling and slowly exhaling. Cardiac patients should be very careful when they do this. If you are having a severe back pain or vertebral and disc disorders, or you have immediately undergone some abdominal surgery, you have to avoid this. Slowly and steadily. We come to the next one, Samasthiti. Inhale, lift your arms up at the shoulder level, palms facing downwards. Exhale, bend the knees and bring down your body to the squatting position. In the final position, both the arms and thighs should be parallel to the ground. Inhale and straighten the body. Exhale while bringing down the hands. Slowly stand up. Repeat 2 more times. You may not be able to do this without practice, but slowly if you practice, you'll be able to do this. This helps in strengthening the knees and hip joint. Avoid this asana if you are having any problems of arthritis with your knee. So these were the warming up exercises before you do the yogasana. If you do this, the circulation to all the joints will increase, and this microcirculation is very important in reducing the degenerative processes in the joints. Next, we will go to the yoga postures. Today, we will be discussing about and performing the standing postures. First will be Tadasana. Tada means palm tree. It also means the mountain. This asana teaches one to attain stability and firmness and forms the base for all the standing asanas. So this is the basic standing pose. Stand with the feet 2 inches apart. Interlock the fingers and turn the wrist outwards. Now inhale, raise the arms up and bring them in line with the shoulders. Slowly raise the heels off the floor and balance on the toes. Stay in this position for 10 to 15 seconds. Exhale and bring the heels down. Release the interlock of the fingers and bring the arms down parallel to the trunk and come back to the standing position. So those who are not able to do this of raising your heels off the floor, if you are falling off balance, you can take the support of the wall behind you when you are doing this. Or you can put a small support below your heels so that you don't have to stand on your toes because the support will be there of the heels. Now we'll do it one more time. Interlock the fingers and turn the wrist outwards. Now inhale, raise the arms and bring them in line with the shoulders. Raise the heels off the floor and balance on the toes. Stay in this position for 10 to 15 seconds. Exhale, bring the heels down. Release the interlock of the fingers and bring the arms down parallel to the trunk and come back to the standing position. So you must have seen that a severe stretch is made when you are interlocking the fingers and stretching your body. So your entire vertebral column will be stretched and all the muscles of the back will be getting this pressure. This is to increase the elasticity of the back muscles. This asana brings stability in the body, helps to clear up congestion of the spinal nerves, corrects the faulty posture, helps to increase the height up to a certain age. However, avoid lifting the toes in case of acute cardiac problems, varicose veins, and vertigo. So this is the basic standing pose, Tadasana. Now we will go to the next asana, which is called Vrikshasana. Vriksha means tree. The final position of this asana resembles that of a tree. Stand with the feet 2 inches apart. Focus on a point in front. Exhale. Bend the right leg and place the foot on the inside of the left thigh. The heel should be touching the perineum. Inhale and extend the arms and join the palms. Stay in this position for 10 to 30 seconds and breathe normally. Inhale and exhale. Inhale and exhale. Exhale and bring the arms and right foot down. Exhale and bring the arms and the right foot down. Now do it with the opposite leg. Focus on a point. Exhale, bend the leg. Place the foot on the inside of the left of the thigh. Heel should be touching the perineum. Inhale and extend the arms. Stay in this position for 10 to 30 seconds. Here also, remember, if you are not able to hold this position because you are not able to balance yourself, you can take the support of the wall. Exhale and bring the arms down and the foot down. This improves the neuromuscular coordination, balance, endurance, and alertness. It tones up the leg muscles and rejuvenates the ligaments also. Please avoid this practice in case of arthritis, vertigo, and obesity also, because you may fall down. If you have vertigo and if you are severely obese, you may fall down. So you have to be careful when you do this. The next posture is Pada Hastasana, the hands to the feet posture. Pada means feet, Hasta means hand. Therefore, Pada Hastasana means taking the palms down towards the feet. This is also called Uttanasana. It's also called as Uttanasana. Stand straight with the feet 2 inches apart. Inhale slowly and raise the arms up. Stretch the body from the waist. Exhale and bend forward until the trunk is parallel to the ground. Exhale and bend forward until the entire palm rests on the ground. The entire palm rests on the ground. You should be careful that you don't bend at the knees. If you are bending at the knees, you will not be able to do this properly. Maintain this final posture for about 10 to 30 seconds. Those who are having a stiff back should bend according to their capacity. You can be holding your legs also. You don't have to touch the feet. Slowly you will be able to get to the final correct posture. Now inhale, come up slowly to the vertical position and stretch the arms above the head. Exhale and slowly return to the starting position. Relax in Tadasana. Relax in Tadasana. Take slow, deep breaths. This asana makes the spine flexible. It improves digestion and prevents constipation and menstrual problem. This also helps in strengthening your back muscle. For people who are having lumbar spondylosis, be careful when you do this. But all of you are youngsters. Many of you who have joined are youngsters from all over the country and also different parts of the globe. Remember, all the youngsters who don't have any problem can do this without any fear. But all the people who are a little aged and have some severe back problems, you have to go to your doctor first before you do this. Otherwise, you can do a few simpler asanas which will be told tomorrow in sitting postures. and then you can come to this standing posture. But for all students and people who are below 25, this can be done without any fear of injuring yourself.
Sir, Srinivas sir, I think your demonstrator camera is off. Demonstrator camera is not visible. Prasad, you can make Perenical once again as a co-host. Sir, you have three Perenical. One is Devika Perenical, another is Srinivas Rao, and one more is Perenical.
Srinivas Rao Perennial.
Sir, that is Srinivas Rao is already co-host. All three we have made a co-host, sir. Now you can switch on the video.
Yeah. Thank you. Sorry for that interruption.
It's okay, sir.
Yeah.
Still the video for the demo. Yes, now it is on. Very good.
Yes, sir. Yes.
For the information of participants, we do have two participants who will be demonstrating. The name is Perenical. Okay, you can set your grid like a view. So you can set up yourself, show participants with videos only. You can click so that you can see the people who are practicing and the people who are doing. So you can set yourself. Go to the view. In the view, you can click show participants with video. Show participant with video. You just click so that only you could able to see the screen with the participants. So we do have two participants who will be demonstrating. I request Srinivas sir to continue because we can able to see those demonstrators on the screen. Thank you.
Yeah. Thank you, sir. Because this was not. Because
Sir, go ahead, sir. Sorry for the inconvenience. There is some technical issue with the master trainer.
yeah. Now I think.
Sir, now it is visible, sir. Please.
Yeah, it is visible now.
Yeah, visible. You just can speak, sir. Now don't do anything.
Yeah.
Just on speaking, they will do the.
Thank you very much. So I think by Padahastasana it was off. So once more we will do the Padahastasana.
Yes, sir.
First we are standing in the Tadasana, which is the basic posture. Exhale, bend the right leg and place the foot on the inside of the left leg. The heel should be touching the perineum. Now, please come down. Please come. Yeah. Padhastasana we will do. Stand straight with feet 2 inches apart. Inhale slowly and raise the arms up. Stretch up the body from the waist. Exhale and bend forward until the trunk is parallel to the ground. Exhale and bend forward until the entire palm rests on the ground. Maintain this final posture.
Srinivas sir, my small request, your camera should not move away from the participants. One participant can face to one side and one can face to you, so that one will be showing on the side and one will be showing on the front. So 3D view can be seen.
Okay.
Side by side, not in the same facing. One can face to other side and one can face one side. Sir, you are muted yourself.
Yeah.
Sir, still you are in a muted state.
Okay. I mean, the video has somehow again, yeah, it has come.
Yeah. So just you keep that mobile. Don't touch the mobile at all. Just keep
Yeah.
it stay. Let it be stay. Then you can just narrate. Your narration
Yeah.
is audible, and we can
Okay.
see the participants who are demonstrating.
Okay. Okay.
Yeah, go ahead, sir.
Ardha Chakrasana is the next posture, the half wheel posture. Ardha means half. Chakra means wheel. In this posture, as the body takes the shape of a half wheel, it is called Ardha Chakrasana. This is a basic pose which anyone can do. Support the back at the waist. Support the back at the waist with all the fingers together, pointing forward or downward. Drop the head backwards and stretching the neck muscles. As you inhale, bend backwards from the lumbar region. Exhale and relax. Stay here for 30 to seconds with normal breathing. Inhale and slowly come up. Ardha Chakrasana makes the same spine flexible and strengthens the spinal nerves. It also strengthens the neck muscles and improves breathing capacity. It helps in cervical spondylosis. So once more we will do this. Support the back at the waist with all the fingers together, pointing forward or downward. Drop the head backwards and stretching the neck muscles. As you inhale, bend backwards from the lumbar region. Exhale and relax. Stay here for 10 seconds with normal breathing. Inhale and slowly come up. Same precautions because it's a standing posture. There should not be done with people who are having vertigo. Now we come to an asana called Trikonasana. Stand with your feet comfortably apart. Before we do this Trikonasana, we should understand that this asana is for our complete stretching. Stand with your feet comfortably apart. Slowly raise both the arms sideward till they are horizontal to the floor. Exhale slowly, bend to the right side and place the right hand just behind the right foot. The left arm is straight up in line with the right arm. So it is in a straight line. You can see here. It is in a straight line. If you are not able to touch the foot, you can just hold your leg. If you are not able to touch the foot, you can hold your leg. You can take the support of the wall also when you are doing this. Remain in the posture for 10 to 30 seconds with normal breathing. Inhale and slowly come up. Now repeat for the opposite side. Stand with your feet. Slowly raise both the arms sideways till they are horizontal. Exhale. Slowly bend to the right side. Place the right hand just behind the right foot. Raise your hands. Look at the upper part of the hand. This asana prevents flat foot. It strengthens the calf muscle. Slowly come up. Relax in Tadasana. It strengthens the calf muscles, thigh muscles and waist muscles. Makes the spine flexible. It also improves the lung capacity. Avoid this posture in case of slip disc, sciatica and after undergoing abdominal surgery. Do not do beyond the limits. That's why I asked you, if you are not able to put your hand till your ankle, you can hold your leg. And don't overdo the lateral stretch. This completes the asanas today. We will be doing 2 pranayams because asana and pranayam are very important. Today we'll be doing the pranayam. First pranayam is called Kapalabhati. For this, you can sit in any sthiti or meditative posture. Here, Ms. Maunika and Bhumika are sitting in Padmasana. You can also sit in Sukhasana, or you can also sit on a chair and do it. Most important thing is your back should be straight. Sit in any meditative posture. Close the eyes. But because you have to see, only the demonstrators will close the eyes, whereas you see what they are doing. So relax the whole body. Inhale deeply through both nostrils. Expand the chest. Expel the breath with forceful contraction of the abdominal muscles and relax. Do not strain. Continue active, forceful exhalation and passive inhalation. So only the exhalation is forceful, the inhalation is passive. Complete 30 rounds, 30 breaths. If you are not able to do 30 breaths, take only 10 breaths. Then take a deep breath and exhale slowly. This is one round of Kapalbhati. That means you are inhaling through both the nostrils, you are expanding the chest, then you are breathing out forcefully, you are doing the forceful expiration and inhalation is passive. You are taking 30 rapid breaths like that, then you are taking a deep breath and relaxing. Watch once more. Close. Take a deep breath, both nostrils, expand the chest, expel the breath with forceful contraction. Here only the abdominal muscles are acting. They are not moving the shoulders at all. Only the abdominal muscles are acting. The breathing is forceful exhalation by contracting of the abdominal muscles without any undue movements in the chest and shoulder regions. Inhalation should be passive throughout the practice. This is very, very important because tomorrow we'll be learning another pranayama where both inhalation as well as exhalation are active. Here, inhalation is passive. Number of rounds. Beginners can practice 3 rounds of 20 breaths, but you can go on increasing depending upon your capacity. This pranayama is very useful in COVID times. Any person who has recovered from COVID also, you can ask them to do this because this reduces the fibrosis which has taken place. So it improves the elasticity of the lungs. So to prevent COVID also, this is useful. To people who have got COVID, for those people also, this is very useful. It also purifies the frontal air sinuses and helps to overcome cough disorders. It is useful to treat cold, rhinitis, sinusitis, asthma, and bronchial infections. So people who are asthmatic will be relieved by this because the elasticity of the bronchioles also increase. It rejuvenates the whole body and keeps the face young and vibrant. It balances and strengthens the nervous system and tones up the digestive system. So this pranayama is helpful for different systems of our body. Please avoid this practice in case of chronic cardiac conditions and people who are having giddiness and very high uncontrolled blood pressure. People who are having vertigo or chronic bleeding in the nose or epilepsy, migraine or cerebral stroke or any hernia of the abdomen or gastric ulcers. These people better not do this because you will be increasing your abdominal pressure when you are doing this. So such people need not do this. Next, we come to a very important and a very scientific pranayama for COVID, because this pranayama, which is called Brahmari, the word Brahmari is derived from Brahmara, which means a black bee. During the practice of this pranayama, the sound produced resembles the buzzing of a black bee. Sit in any meditative posture. This improves the nitric oxide which is produced by the blood vessels of the lungs and also the blood vessels of the skull. There are 2 techniques. First technique is sit in any meditative posture like you are seeing Miss Monica and Miss Bhumika doing it with their eyes closed. You watch it with your eyes open today. From tomorrow, we'll be repeating all the postures which we did today. There you can practice with your eyes closed. Inhale deeply through the nose. Exhale slowly in a controlled manner while making a deep, steady humming sound. This is 1 round of Brahmari. Again, deeply inhale through the nose. Exhale slowly in a controlled manner while making a deep, steady humming sound. Take slow deep breaths. Inhale deeply through the nose. Exhale slowly in a controlled manner while making a deep, steady humming sound. This is one type of Brahmari. Now the second type, sit in meditative posture with eyes closed. Close the eyes with the index fingers, mouth with the ring and small fingers, and ears from the respective thumbs. So close the eyes with the index fingers, mouth with the ring and small fingers, and ears from the respective thumbs, as you are seeing Miss Monica and Miss Bhumika doing it. This is called Shanmukhi Mudra. Now inhale deeply through the nose. Exhale slowly in a controlled manner like the previous time with a deep humming sound. This is one round of Brahmari. Slowly breathe, take normal breaths. Take a deep breath now and again exhale. Take slow deep breaths. Inhale slowly. Breathe out with the sound. Again, take slow deep breaths. Take a deep inhalation and exhale in a slow, controlled manner with the sound. This practice will slowly come back to the relaxed posture. This practice of Brahmari relieves stress and helps in elevating anxiety, anger, and hyperactivity. The resonance effect of the humming sound creates a soothing effect on the mind and nervous system. It is a great tranquilizer. It is found good in the management of stress-related disorders. It is a useful preparatory pranayama for concentration and meditation. Please avoid this if you are having any ear infections. So I hope you had a very good experience of today's session. I will end this session with a small prayer because all yoga sessions are ending with a meditative posture, I told you. So I will end it with a small prayer. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvidavaditamastu ma vidvishavahai. Om Shanti Shanti Shanti. The meaning of this prayer is, Om, may we all be protected, may we all be nourished, may we work together with great energy, may our intellect be sharpened, may our study be effective, let there be no animosity amongst us. Om, peace, peace, peace. If any one of you have any doubts, can ask for 5 minutes before we close this session. Anyone has any doubt can ask or put it in the chat.
Thank you very much, Srinivas Garu, for today's session.
One question I have, sir.
Yes, sir, please.
Yeah, about food in the stomach. See, any posture is preferably done in the morning because you have an empty stomach. But that does not mean that it has to be done only in the mornings. It can also be done in the evenings after you take your lunch you can do it after 2 hours. Suppose you have taken your breakfast after 1.5 hours. That means the stomach is empty. It's not that it has to be only in the morning. Understood? You can do it any time of the day. And all the postures which I have chosen now, many of them can be done in your college, in your office room, anytime. See, neck bending exercises, all the Santulasans which I told you can be done anytime. Only the postures which require more pressure, like for example, Trikonasana or Padahastasana, those things you have to do about 2 hours after taking food. But otherwise, all the postures which were told today can be done anytime in your office. The pranayama also can be done half an hour after taking food also. After your breakfast, you can go to your college, or when you're going in the bus, you can do it. Only thing is your mind has to be totally relaxed. We'll be teaching 2 more pranayamas tomorrow, and tomorrow's yoga postures will be about sitting postures. So it will be easier tomorrow. And all standing postures, don't close your eyes. Always keep your eyes open, because by chance you fall down, you will know where you are falling down. There is a chance of falling down if you close your eyes rather than opening your eyes. If you keep your eyes open, the chance of falling down will be very low. And as someone told, you can take the supports. You can take the support of the wall when you're doing that. When you are not sure that you'll be able to maintain your balance, you can take the support, no problem, because the medical benefit will be the same. As a matter of fact, we have Dr. B.K.S. Iyengar Yoga, where everything is told with supports only. Supports are taken and then the posture is done. The medical benefits of the posture will be useful when you do it with the supports also. Understood? So that is nothing to worry. Yeah, thank you. That was the only question I had.
Sir, thank you very much at the outset from NSSL, Dr. NTR Health University. Today is the first day and we are overwhelmed response. More than 850 people who are directly attended the Cisco WebEx platform, and we could able to see more than 100 students in Facebook live. And there was some technical difficulties associated with the participants. They are unable to hear and they are unable to visualize the video in Facebook and sometime in the Cisco WebEx. I request all the participants, those people who are viewing us on Cisco WebEx, you please go to the view panel. In the view, there will be a show participant with video only. So if you click show participant with video, definitely you are going to visualize the people whom you are going to see. Those people whose camera is on, they only can be seen on the screen. Number one. Number two, those people who are watching us on a Facebook Live, they can go to the Facebook Live. You are going to able to hear if your internet connectivity is good, bandwidth is good. Then we are changing the layout to the only active participants so that you can able to visualize in Facebook Live also. I hope whatever today Srinivas Garu has informed you people, you please do follow tomorrow morning and once again come back to tomorrow evening with the same session. And end of the day, we are going to give you the list of all the asanas and pranayamas which you are going to perform every day after the session. So that's how we can guide you people for 5 days. And at the end of the day, if you have any doubts, you for clarification, you please put on a chat box. Our organizing people are going to come out with the answers and they will answer your queries. Thank you very much at the outset once again for all the participants and demonstrators, Vice Chancellor Sir Shyam Prasad Garu, Registrar Dr. Shankar Garu, and head of the institutes who have joined for this program. So thank you once again. Thank you all. Stay safe, be safe. Please wear mask until everybody gets a COVID vaccination done. Thank you.
Thank you, sir.